We all have increasing demands on our time today, and we're all asked to do more and more in less and less time. And as we talked about earlier, the literature is growing exponentially. Pathologists who are just beginning their careers are well aware of how important it is to keep current in the literature. I think the advantage of Pathology Network for them is, again, it's one-stop shopping for the latest in pathology literature. Pathology Network is designed to be a time and cost-saving tool to make it as easy as possible for all of us to stay up with the pathology literature. The electronic version of journals, the electronic means of keeping up to date with pathology is really the wave of the future. Path Network allows you to set up your own customized page, if you will, a home page for your pathology knowledge base. You can set up channels to have articles from a particular area of interest funneled directly to you. One particular area for me is head and neck pathology, so it's very easy for me to set up a channel that allows me to pull all the head and neck pathology articles, both the backlogged articles and the new ones as they come out. In addition, I've set up channels for breast pathology, bone and soft tissue pathology, and genitourinary pathology, and it takes literally just seconds to set these up. Well, we're delighted to have the journal Pathology join Pathology Network. It's a great addition to Pathology Network because it has very practical articles for practicing pathologists, and in addition it has a substantial number of clinical pathology articles. We've added publish ahead of print, which I think is a big step forward. It allows readers to see articles basically as soon as they're ready to be published, which is often 6 weeks or more before the print version appears. I publish a blog entry at least once a week. The topics are basically medically related, but they may not always be pathology related. I've written about things as seemingly esoteric as my experience with an iPad and what I think are the pluses and minuses of it. We've converted the image of the week to a second blog, which allows me to have all of the prior images online for people to see. The advantage of having it as a blog is that it gives you or readers a chance to comment on the case. We've also added the ability for group practices to purchase a group practice plan, which allows up to 4 pathologists to have access to Pathology Network in the same group. So the basic goal is to make it as easy for users to use as possible, to make the search engine even more sophisticated than it is now. The crux of Path Network is that you can focus on what matters most to you.